Hello, my name is Abigail Wagner, and this is my psychology project, Mood Disorders on Placebos, Why They Work and Why We Can't Use Them. To jump right in, let's start with why I'm doing this topic, as well as a few of our definitions. The purpose of my presentation is to show how the placebo effect can have a positive impact on mood disorders and to discuss the ethical concerns surrounding its use as a treatment outside of experiments. Some basic definitions that may help with these concepts are the placebo effect, which is when a person's physical or mental health appears to improve after taking a placebo or dummy treatment, the nocebo effect, which is a situation in which a patient develops side effects or symptoms that can occur with a drug or other therapy just because the patient believes they may occur, and mood disorder, which is a category of mental illnesses in which the underlying problem primarily affects a person's persistent emotional state, that is, their mood. Now, the first mood disorder I'm going to talk about is anger. This disorder is much more than just being angry a lot. In reality, it's being far angrier than the situation would cause normal people to be, meaning that people afflicted with this might partake in excessive voice raising, breaking or damaging things, and quickly escalating situations or conversations into emotional outbreaks and arguments. The study I got my research from is shown here, along with this quote from it. Quote, "The study found that, in general, the NTR, meditation, and placebo groups showed reduction in trait anger, anger across situations, unconstructive coping, physiological symptoms of anger, and anger aroused by high anger situations nominated by the subjects. These improvements were maintained at follow-up. The no treatment group did not report improvement in anger across situations, unconstructive coping, and anger measured through physiological symptoms." End quote. Now, what does this quote mean? This is telling us that all three main groups, the NTR, meditation, and placebo, all showed reduction, none significantly outperforming the other, as opposed to the no treatment, which did not report any improvement. This means that the placebo for this worked just as well as the other two groups, proving my point that the placebo is effective thus far. The next disorder is a rather obvious one, depression. I believe that this is an overhyped but undervalued disorder, meaning that lots of people know what it is, and maybe even claim to have it, but the people that actually suffer from it can often be overlooked. Now, the quote I have here is quite interesting. Quote, "A systematic review by Walsh and colleagues 39 showed large placebo responses across randomized controlled trials, RCTs, for diagnosed depressive disorder. These findings were corroborated in a meta-analysis of placebo responses from treatment-resistant depression trials reporting a very large effect size, equating to a 30 to 50% reduction in depression symptoms on standard outcome measures. A well-designed prospective placebo-focused depression RCT showed that pre-treatment patient expectancies are a substantial mediator of therapeutic responses. In this variant of an open hidden paradigm, if participants were told they would be receiving placebo but actually received citalopram, their Hamilton Depression Rating Scale scores were significantly worse than participants who were told that they had 100% chance of receiving citalopram." End quote. Now, what this quote is talking about is in the study that they did, the participants that were told they would get the placebo but actually got the medication, they still had worse depression symptoms than those that were told they were getting medication but actually may have been getting placebo. Once again, proving my point that the placebo is quite an effective method in treating mood disorders. The final disorder I'll be talking about here, while it certainly is a mental disorder, isn't a mood disorder. Anxiety has its own branch of disorders, but since it is another well-known one, and it shares several characteristics with mood disorders, such as irritability, difficulty focusing, and the possibility of psychosomatic symptoms, such as insomnia or eating troubles, I thought I should include it here. To continue, this study compared L-theanine, a natural relaxant found in green and black teas, with a placebo as a control, and this is what they found. Quote, we conducted a 10-week study consisting of an 8-week double-blind placebo-controlled period and 1-week pre-study and 2-week post-study single-blind observational periods involving 46 participants with a DSM-5 diagnosis of GAD. Participants received adjunctive L-theanine, 450 to 900 milligrams, or matching placebo with their current stable antidepressant treatment, and were assessed on anxiety, sleep quality, and cognition outcomes. Results revealed that adjunctive L-theanine did not outperform placebo for anxiety reduction on the HAM-A, nor insomnia severity on the Insomnia Severity Index. However, L-theanine-treated participants reported greater self-reported sleep satisfaction than placebo. End quote. Now, what is this quote talking about here? They conducted a 10-week study and found that L-theanine, while it still worked somewhat, did not outperform placebo, which means that the placebo, you can infer, outperformed L-theanine and worked better. Now, it may not have had the participants report greater sleep satisfaction than the placebo, but overall it reduced the main symptoms of anxiety, being anxiety itself and the insomnia. To return to the first question posed in my title, why does it work? Allow me to read this quote. Quote, how placebos work is still not quite understood, but it involves a complex neurobiological reaction that includes everything from increases in feel-good neurotransmitters, like endorphins and dopamine, to greater activity in certain brain regions linked to moods, emotional reactions, and self-awareness. All of it can have therapeutic benefit. The placebo effect is a way for your brain to tell the body what it needs to feel better. But placebos are not all about releasing brain power. You also need the ritual of treatment. When you look at these studies that compare drugs with placebos, there is the entire environmental and ritual factor at work. You have to go to a clinic at certain times and be examined by medical professionals in white coats. You receive all kinds of exotic pills and undergo strange procedures. All this can have a profound impact on how the body perceives symptoms because you feel you are getting attention and care. End quote. Now, this quote really does speak for itself, but to summarize it, it is both a mix of your brain and the situation that you are in. Now, to move on to our next slide. As we have seen from the previous slides, the placebo has at least some effect on mood disorders as well as anxiety. So why can't we use it as an actual treatment instead of strictly in clinical trials and experiments? The answer is simple. It's deceitful. If we take a look at this quote here, we can start to see why. Quote, several core ethical principles are directly relevant to avoiding deception and non-disclosure in medical practice. Honesty entails a moral duty for physicians to provide truthful, accurate, and complete information to patients, forming the foundation of professional integrity and protecting patients from misinformation and harm. Honesty in medical practice goes beyond avoiding deliberate falsehoods. It requires active transparency in discussing diagnoses, prognoses, treatment options, and risks. Without honesty, the physician-patient relationship risks devolving into paternalism, where decisions are made on behalf of patients without their fully informed input. End quote. Now, this quote speaks for itself. It is very dangerous to lie to patients, where things can easily snowball into paternalism or just progressively lying down the road. Now, if we want to look at this from a slightly different perspective, a Christian one, or at the very least biblical, there's a verse in Ephesians chapter 4 that says, therefore, having put away falsehood, let each of you speak the truth with his neighbor, for we are members of one another. This means we are all interconnected. We should all love our neighbor, correct? So we should not lie to them. Now, one may give the argument that we are lying for their benefit. We are lying so they can get better. We are telling them this is a real working treatment. And while it may help them, there's also the risk of nocebo. This is why I brought up the definition at the beginning. The possibility of nocebo effects. If you give a person a medication and they read up on it and see all the side effects. If they were to take it and then be concerned about those possible side effects, they could develop them, even though it is merely a placebo. That is the main ethical concern, at least to me, in the involvement of placebos in our day-to-day life as treatments. We really shouldn't risk it. So, in conclusion, the placebo can be and is used for good, such as small scale scenarios like comforting or holistic approaches, and of course, experiments and trials. But that doesn't mean it's good to use it as a treatment outside of these scenarios. From a biblical perspective, truth is crucial to have in our world today, but even aside from that viewpoint, lying and deceit is still bad. Now, of course, sometimes we need to lie, but when it comes to treating mood disorders, clearly it is best to stick to real, honest solutions. Thank you for watching.